the
Yep,
presentation? Okay.
That's all good.
Wonderful, thank you so much. So thank you everyone for being here. I really do appreciate you giving your time today. My name is Christina Farrell. I'm the Programme Officer for the School of Primary Care Research. On the call we also have Georgina Fletcher, our Assistant Director, and you just heard the voice of Jess Nye, who's our Senior Programme Manager. We also have quite a few of our PPI leads who are here to help answer any questions that we may have at the end and to say hello to everyone, so I really do appreciate them being with us today. We've got the webinar recorded, so you can watch it back in case you miss anything or you want to share it with colleagues. Do feel free to use the chat function as I give my brief presentation, and we'll have plenty of time to go through any questions that you may have, or if you want to put your hand up at the end. So I know that many of you will be familiar with the School of Primary Care Research, SPCR, but for those that aren't, we're a partnership of academic centres for primary care research. So we've got Bristol, Exeter, Keele, Manchester, Nottingham, Oxford, QMUL, Southampton and UCL, and I do have to do that on my fingers every time to make sure I've got all 9. Our mission is to increase the evidence base for primary care practice and to increase the research capacity in primary care. In addition to conducting high profile research, we attract the best new researchers into our capacity and development programme and offer trainees support, networking opportunities, training. Patient and public involvement and public engagement is integral to the school's research and development activities, and we have quite an extensive section on our website that includes information, resources, and also our PPI strategy that was published earlier this year, so please do take a look if you haven't had an opportunity before now. We would like to contribute to NIHR's ambition to develop new and creative ideas for patient and public involvement and public engagement activities. To assist with this, we've launched this funding call for the 9 members, and it provides researchers with funds to trial creative, new, novel ideas for projects to work with people with lived experience and for the wider public. This is the 3rd time that we've run this call, and the funding will enhance involvement activity work that's already being done and add those novel and creative methods, or reach out to communities that are not currently in people's existing plans. The call is not meant to compensate for insufficient PPI budgeting when you've already had a research grant application written, but it's to complement those planned activities. So please don't be afraid to try new and inclusive things. It's okay to take a risk. It's okay to try something a little different. So this call is open to researchers that are affiliated with an SPCR member department for the duration of the proposed project, and it's for researchers from all career stages, but PhD students, junior researchers will need to get their supervisor's approval. We do, of course, encourage cross-school collaboration, and people from outside of the SPCR membership can be involved in applications, but the majority of the funding needs to stay within an SPCR member. The proposed projects need to have a strong link to primary care research, and when they're linked to an existing project, that research can be funded from any national or international funder. They don't need to be SPCR funded projects, but you need to have received a confirmation of award, and it needs to be currently ongoing or very recently finished. Alternatively, the funding could be used to identify research priorities, but you need to clearly state in the application which grant you're planning to apply to, how it will be supported, how it will complement other PPIE work that's in place for that application development. We need to see your clear next steps. We need to know what your process is. Projects can be funded for up to 24 months and with a budget for up to £8,000, but we do of course want to see projects of all sizes, so we welcome smaller funding requests as well. The grant can cover direct costs for development, delivery and evaluation of the project, staff costs, and up to 30% of overheads. Applicants will be required to submit a video and an application form. Excuse me. So I think a few people will say, why a video? And this is new to this funding round. It was developed following feedback from our last funding panel and in discussion with our PPI leads. The aim of the video is to help applicants to really demonstrate their enthusiasm for the project, and to do that in their own way. It can be very hard to do that within a word limit on an application form. So you'll have your video, and you'll be supported by some basic information on your application form. How you present that video and who's on screen, how it's totally up to you. It could be a recording of a presentation, a bit like this. It could be a speech to camera. You could even use animation software. As long as the sound and the visuals are clear and easy to understand. We recommend a video length of about 5 minutes, and certainly no more than 8, but we're not being very prescriptive on the exact timing. We have put together some helpful information on filming and editing your video, and that can be found in the guidance notes online. So it's important to know what information that video should contain. So we need a brief introduction on who is in the video, the project team behind it, information on the project, what is it you want to do, what are the aims and objectives of the project, why would you like to do the project, who are the audience that you wish to engage with or involve, why have you chosen them, how are you going to reach them, and what outcomes will your project provide, will there be any changes and benefits to stakeholders, and how are you going to evaluate your project. This is your opportunity to really show your enthusiasm and your belief in it. And then the application form to accompany the video. We do have a template on our website that needs to be completed, and there is advice on how to do that in our guidance notes. Only the information that is contained within the video and the application form will be seen by the review panel. So please don't provide any hyperlinks or any appendices. The 3 sections to the form. The first will ask you for relevant information on your project team. As we mentioned, the lead applicant needs to be affiliated with an SPCR member, but co-applicants can come from outside of our membership. The second section will be used to provide information on your proposed project. We expect the summary of your project to reflect or maybe even repeat the information that's in the video, but if your project is successful, we will publish that on the SPCR website. We've also asked for a summary of your planned research that the engagement project is linked to. So if your project relates to a particular work stream within a larger research programme, focus on that element. The summary should also include information on who the funder is and the timelines. But if you're linking this project to the development of a research application, please specify what competition you plan to apply to, what the timelines are before grant application, and as much detail as you can give on the question, the topic, the methods will be. Again, we need to see those clear next steps, what you're going to do. As this funding call aims to encourage new practices, the proposal should complement any existing plans that you have, and we therefore will ask you to describe how the proposed project will add value, how it will differentiate from current involvement and engagement plans for the research that you've listed. Also, in the third section, we have a question asking you to break down your budget for this project and state whether there's any match funding available. So relevant sections may be involvement costs, contributions to community groups, consumables, training, staff costs, overheads. That's not an exhaustive list. Every project is going to have different. And again, you don't have to apply for the full £8,000 that's available per project. Smaller funding requests are equally as welcome. If you have any questions about the video or the application form, please don't hesitate to contact me. And also your local PPI leads are available to support you with the development of your proposal, but please plan that ahead to factor in the time that you'll need. Your video should be clearly labelled. In the guidance notes, it has details on that, and ideally shared with us via SharePoint. I do appreciate that not every university uses that, so if you have a different way that you wish to share it with us, contact me in advance, discuss that with me. Please don't leave it to the last minute in case there's any problems with sharing. We can't accept any videos or any application forms that are sent to us past the deadline. So a review panel will meet in early February and assess all of the applications to the funding call and then make their recommendations. An independent chair will lead the panel, and that consists of 3 public contributors, 2 primary care researchers and 2 PPI professionals.
All right. Nina, would it be okay if I just call you at 3? Would that be all right? I'm just in a meeting.
Sorry, I can't. Was that a question? I couldn't quite hear.
Okay, I'll give you a call at 3.
I think someone's talking on their phone. Sorry about that. We aim to communicate the outcome of that panel and give feedback to all applicants the week commencing the 13th of February next year. The panel can fund under condition, which means if they can see the value of the project, the belief of the team, but they need to get some more information, perhaps suggest a change in methods, they can do that. That would be communicated to you via the SPCR Directorate team, and following any changes that have been requested to make, we can make the decision on whether those funding conditions have been met. If your application is successful, you will be asked on completion of the project to fill out a reporting form. SPCR have a template that we would use, and also write a blog for our website. And of course, we will help share any dissemination that you do. Further reporting can be set as a funding condition by the panel. So some examples of what we've funded in the past. The 2 that are listed there on the slide have videos on our YouTube channel if you'd like to view them. One of them was a co-designed, co-delivered project looking at what training needs. People with learning disabilities and their family carers felt they needed to act as co-researchers. The team wanted to discuss that with them rather than it being identified by the academic researcher, and they produced some training resources as an outcome of that project. We also had a project that discussed ideas and best ways of communicating research with members of underserved communities, people affected by dementia, people living with mental health conditions, and they brought those discussions to life with artwork. Videos of both of those are available on the website, but we've also linked through our guidance notes. You can see some details of other projects that we've done. So we had co-produced video on mental wellbeing after childbirth. There was an event organised on the topic of health and wellbeing for members of a rural community, and some public engagement activities to raise awareness and use creative approaches to engage children with eczema and their family carers. So real diversity of what we've funded before, and do have a look at those if you are interested in what has gone before in previous rounds. So just to end on a few top tips, please work with public contributors in development of your proposal and describe this work and its influence on your application. They don't need to be co-applicants, but we want to see your thinking behind the proposal. Make sure that you answer all the questions when making the video. It doesn't need to be formulaic, a question and answer, but we need to be able to tick off all that information. If the video is a presentation, practice with somebody who's not an academic. We expect that video to be in plain English, just like the application form. So does it make sense on first hearing to someone new to the project? Get somebody's feedback on it. And please make sure the sound and vision are clear. We can only review what we can see and hear and read in your application. And as we've said, show that clear path for next steps, that project dissemination, that integration with your current work. What will this project lead to? And make use of your PPI leads. Make sure you plan ahead with them, but they are there to support you. And finally, don't be afraid. Try novel, inclusive projects. It's okay to take a risk. It's okay to try something different. So we are really looking forward to seeing what projects are proposed. Thank you so much for listening to me. I don't think everyone could hear all the work going on outside, and Georgina and I and our PPR leads are here to take any questions that you may have.
Thanks for that, Christina. That was very thorough. Thank you for that, and I'm sure it'll help sort of boost the guidance notes that you've already prepared. So thank you for that.
Thanks. Right, see, let me open up the chat. I think questions have just popped in. Would match funding be viewed favourably? And if it is favourable, are there any expectations around provision of match funding? Can I throw that one to you, Georgina?
Yeah, certainly. There's no expectation of match funding, but it would obviously be, it would be favourably looked upon, but we wouldn't penalise people who haven't got any. It's just whether we always try and think about if any of the School for Primary Care research funding can leverage any other funding. There are pots, with other funders, and sometimes it can help leverage, but you wouldn't be disadvantaged if you didn't have that in.
Thank you. Another one in the chat there. Can you clarify, is this for currently funded projects, not to help with the development of new bids? It can be for either. However, if it's for development of a new bid, we need to see clear evidence of what your plans are, what applications you plan to make, what it's going to support, what the outcome, how the outcome of this project is going to be used. Would you agree with that, Georgina? I
would, absolutely. And I think, just to go back to really your key message, Christina, this is about innovative stuff. So we wouldn't be looking at something like a focus group to discuss a research question or something like that. So you'd have to think carefully about what innovative approach you were going to have to that preparation of a new bid with the PPIE funds.
I think we've got a hand up from Trudy.
Yeah, it's just easier to speak than I was trying to type it out and it's going to take me forever. I'm just wondering whether I would be penalised for having a very small team at this stage. So what I'm looking to do is work with young carers of stroke survivors, take forward some findings from our PhD, which was around information needs and about being recognised by health and social care professionals and involved more. But I want to work with a small group of young carers of stroke survivors to help me shape that question. And I have got a charity, Different Strokes, who are very keen to work with me on this. But the two main people that I was working with at the university, my supervisors have left. All of my supervisors have gone. So I have obviously got people that I could work with, but it will be a very small team because I really want this to be driven by the young people rather than going in with an idea. So I didn't want to go to all this work if you're going to say, oh no, it's a tiny team. And
no, not at all. I mean, let's face it, £8,000 isn't going to go very far anyway. No. So it's not really about the size, it's about again, as what Christina said, adequately explaining what the participants are going to be contributing. But no, there's no size limits or upper or lower.
That's lovely, thank you.
And the question we've got in the chat: if you're applying for a PPIE project that would pave the way for a fellowship, but the fellowship application wasn't successful, that's the door, would this be a factor judged in the application?
Of application of the fellowship or the application? I mean, if you're going to apply for this grant to help you apply for a fellowship, then you are either successful or not successful with the PPIE grant. We wouldn't then we would expect to hear from you about how your fellowship application went, but if your fellowship was not successful, no, absolutely, we wouldn't penalise you or expect any money back or anything like that. So.
The next question in the chat: would innovation methods include creative ways, art, music that engage PPIE groups?
Yeah, absolutely. Yes. If you do go and have a look on our website or on our YouTube channel, you'll see in fact that one of the previously funded projects actually did include arts. Well, several did, and in different types of arts. So yeah, absolutely.
Trudy, is that another question to ask? I think it may be a legacy hand there. I'll go to the one in the chat. Would this grant be suitable for preparing creative dissemination materials, videos, other materials with PPI members for people with particular conditions, i.e. type 2 diabetes, to build into findings from a study currently being undertaken?
Yes, it would. But again, I'll just go back to that word innovative. You know, quite a few research teams do videos now. So you'd need to be very clear about what it was that was new, perhaps even new to the field that you're researching in, or new to research in general. Just be very conscious about, you know, explaining what it is that you want to do and how it could be seen differently from previous methods.
Wonderful, thank you. Are there any other questions that we can help with today? Sarah, can we come to you with your hand up?
Yes, thank you. I was just wondering when we would expect to find out whether we were successful or not.
We would hope to communicate outcomes on the week of the 13th of February.
Okay.
We have our funding panel meeting early February, so that's our current intention. So yes, all applications will be reviewed by that panel.
Thank you.
If we go to the question in the chat, would this grant be suitable for using traditional methods on PPI but integrating it into a growing area that PPI currently does not happen in? Sorry, I couldn't get my words out then.
I'm not sure that's exactly what we're trying to aim for here. This is about the PPI method, really. That's Becky. You're in Exeter, aren't you, Becky? Nice to meet you.
Yeah, sorry, is it easier if I explain a bit?
Yeah.
So we were thinking of creating a framework that would help to direct how to actually go about PPI in this new, so it's based around big data and how it's not really clear how to sort of do PPI in that setting, because it's quite a difficult situation if we have a project to be linked with that. But we want to sort of create a framework that will help direct people to actually engage in PPI and big data research.
Okay, yes. So presumably you will be involving the public in the development of that guidebook, that
yes.
framework. Yeah, okay. Yes, then yeah, I could see that could be eligible, yeah.
Okay.
Yeah.
Thank you.
Julia?
Thank you. My question's about the innovative methods versus outreach to under-reached populations. So I would like to do some research agenda setting with intersex people and people with sex variation. So that population is extremely absent from primary care research. But in terms of the balance, if it wasn't particularly innovative methods of outreach, but it's a very underrepresented population, is that still worth applying?
I think I might need to get back to you on that, because that is a little bit like Becky's email read. I think really this is about methods rather than about groups. We are planning another funding call, and it might be that we slightly change the focus of that one. This one is definitely about methods, I think, Julia. But let me just have a little reflect, and I'll get back to you.
Lovely, thanks.
Thank you both. Are there any other questions that we can help with? Someone commenting that they'd also be interested in the answer to that. So yeah, something we can definitely.
FAQs up, could we, Christina?
Absolutely.
Yeah.
Absolutely.
On the web page.
We'll go through. Not only will we put this video on the YouTube, but we'll go through the questions that are answered and give some more details.
Yeah.
Wonderful. Are there any other final questions at all? No. Well, I think we'll perhaps leave that there then, if that's okay, Georgina. And like I say, I hope, depending on YouTube's timings to get it uploaded, we'll try and get that on YouTube as soon as possible, and I'll email everyone that registered to be on the webinar when that's available to view and share with colleagues. So thank you ever so much for everyone's time today. We do appreciate you joining us and your interest in this funding call, and we look forward to receiving the proposals. Thank you ever so much.
Thank you.